Hi there, here today with Lily. I'm Trisha, and we're going to talk to you about the use of the orthodontic elastics after jaw surgery. So we do have a package here of the ones that we would typically be using for you. You will be leaving the operating room with some really tight, really strong elastic bands in place that are helping to hold your upper and lower jaw in a stable or fixed position that first week after surgery. When you come in for your first post-operative appointment at 1 week, we'll go ahead and switch you to guiding elastics, which will be a little bit looser and permit more movement of your upper and lower jaw. At that point, we'll also clear you for straw use. So having the looser elastics on are going to make that a lot easier also. So we have a small little device or tool that you can purchase on Amazon that makes it a bit easier to manipulate and apply the elastics or remove them. Once we put them on at your 1 week post-op, we are going to recommend that if they pop off or fall off, that you're able to replace them in the home setting. We'll show you where they go and how to do that. It's not an emergency if for any reason they break or snap in the middle of the night. We just wouldn't want you forcefully engaging in any wide opening while they were off or broken. You can give us a call to update us, and then we can go ahead and counsel you over the phone on replacing them if any trouble, or we're happy to see you in person to do it as well. So the elastics are pretty stretchy. I typically recommend when you take them out that you go ahead and stretch them slightly. It just makes them easier to go ahead and put on. You will be fitted with some TADs or temporary anchorage devices or little buttons or screws either in your gum tissue or some small posts that are going to be located on your braces that will be put on prior to surgery by your orthodontist. The elastics are going to fit pretty easily over those posts or screws, and you're going to, with our direction at that first post-op, go ahead and attach the elastic. You can go ahead and do it from the bottom up or from the top down, whatever's easiest for you to do. Make sure that your hands are nice and clean. You can use one of these, again, for purchase on Amazon. You can also use a tweezer, or some patients will actually use their hands. Any way is fine. We'll go ahead and show you exactly where to put them and how to put them there at that first post-op visit. But if there's any questions or uncertainty along the way, please do give us a call so that we can help guide you.
So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com.
Thanks again.